Hello, and welcome back to another episode of Straight Up with Steph. Today, we're talking about desiccation therapy. If you don't know what that is, definitely listen to this episode because I think that it's something that's relatively new to dentistry. But I do think after talking to my guest today, I think that this is something that could really help make all of our lives a lot easier. Just real quick, desiccants are used to dehydrate something. So in dentistry, it's applied to the teeth to dehydrate calculus to make it easier to remove, but it also targets the biofilm. How I was trained, and I've been a hygienist for over 17 years now, it just was drilled into me to remove calculus. Okay, that was like my main objective. But now we're learning, I mean, yes, that is important, but we also need to look at the biofilm and how we can address that as well. It's not just about removing hard deposits off of the teeth. And that's what my guest taught me today was yes, it makes calculus a lot easier to scale, but it's also targeting the biofilm. And if we don't get that under control, our patients aren't going to be truly healthy. And I see this being used for perio patients that come in. I don't practice clinically as much as I used to, but I used to have patients that would come in every 2 to 3 months and just have sheets of calculus every single time they would come in. And I would be happy to see them because they were my patients and I loved them, but I would kind of dread it because I knew how much work it was going to be. So, what if I was using desiccants at the time that could make my job a lot easier? And my guest tells me today that it's even beneficial on the restorative side. Like if a doc is prepping a tooth, you want to make sure that that tooth is squeaky clean and doesn't have the pellicle or biofilm on it, and desiccants can be used for that too. I decided to bring on a guest that I actually just read an article of hers and I really liked it. And I chatted with her a little bit and decided to bring her on the podcast. She's passionate about hygiene, dentistry, but also desiccation therapy. So today was just a masterclass in all things desiccants, how it can be used, how to use it, what we need, how it can actually shorten our appointment times and make our jobs a lot easier. I'm always interested in learning about cool new things, especially things that can help make our jobs easier. So I hope you enjoy today's episode with Annie. Hey, it's Steph, and welcome to the Straight Up with Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Annie. I'm so excited to have you on the podcast. Thank you for joining.
Hi, Stephanie. Thanks so much for having me. I'm really excited to be here.
Yeah, I've been doing some online snooping, like I've stalked you a little bit online
Great. Love
just
it.
to prepare for the podcast.
That's
So I'm really
awesome.
excited to learn about desiccation therapy from you today.
Yes.
So I guess we'll just start there. What is it and how is it used in dentistry?
Yeah. So desiccation therapy, desiccants, it's not something new. So desiccation has been around for a really long time. The process of desiccation is really dehydration. It's taking moisture out of something. So even I was actually doing some research to see like how far back desiccation therapy has been going on. And it dates back to like years and years and years from like early science that they were like dehydrating plants to study them. And so but in the world of dentistry, we really started to see desiccation coming into play like in the 70s and 80s. But I think it's even more so getting part of the conversation now in dentistry because I feel like dentistry, especially dental hygiene, is really moving. The direction we're going is really understanding biofilms. We have,
Mm-hmm.
guided biofilm therapy, really looking at the biofilms. And so desiccation therapy is really unique in that aspect because it targets biofilms. Desiccation, one, it helps soften calculus. So we can definitely get into the nitty gritties of how that works, but it softens calculus, which is a huge win for us as hygienists. And then it also targets the biofilms by really attacking the bacteria within the biofilms. The ingredients within desiccants break down that biofilm like nature and the extra polymetric, material that gets leached into the biofilms. The acids within desiccants really break down those biofilms. And I think that is really critical when we're looking at getting patients to health.
Okay, so it's not just making the calculus softer. It's
No.
also, is it antimicrobial,
Yep.
antibacterial?
Yeah, so a desiccant, not only softens calculus, but typically desiccants have an acid component and a surfactant component. And so the acid, you have your sulfonic acids and your sulfuric acids. And so those acids, one, they not only target that biofilm, they target the EPS, what biofilms secrete outwards. And so that acid breaks down the biofilm. It It is an antibacterial in the sense that it attaches to the cell membranes of bacteria and it causes cell lysis, so the bacteria to die. So that really the acidic component of desiccants are really altering that biofilm nature. And yes, it's antimicrobial, but it also impacts that smear layer as well. And so it inhibits that pellicle formation and that smear layer after we instrument that really impacts how things heal and disinfection. The desiccant also prevents that from accumulating as well.
So if I've got a patient in the chair, because I still see patients here and there.
Great.
Do you still practice clinically?
Not a ton. I'm more in the
Okay.
education space now, so I'm with
Yeah.
students quite a bit full time, but I temp here and there.
Yeah. Okay. So if I've got a patient in the chair, how would I know if they would benefit from desiccation therapy, or does
Great.
everyone benefit from it?
So I feel that everyone can benefit from using a desiccant when we're talking about biofilms. Everyone has biofilm. And that's really, I think, the most unique part of it is what was once yes, scaling root planing is still the gold standard. We still have to mechanically remove calculus, but we know now that it's not just removing the calculus, it's altering the biofilms. And biofilms reside in difficult to instrument areas. I mean, even the best clinician can't reach some of those, hard areas. And so desiccants are so great because they can deliver into those hard to reach areas and start altering the biofilm and improving this quote unquote dysbiosis of, the harmful bacteria thriving and not, and better bacteria not, and kind of getting, more neutral environment there. So, short answer, everyone can benefit from a desiccant because we want to help, alter those biofilms. So when we're talking biofilms, I think everyone can benefit. But so yes, our perio patients using a desiccant is great. Patients that have heavy calculus, really tenacious calculus, why not make our lives a little bit easier? I remember when I first started practicing, I had patients that were like, when are they going to make something that makes it easier to scale this calculus? And
Yep.
now we have something. And so why wouldn't we use that? It's very easy to administer. Patients are very receptive of it. It's going to be easier to remove that calculus. So really any patient that you feel like maybe if you have a patient in your chair that has a lot of calculus, or of course a perio patient, you can use it on all of those patients.
So I want to get into later as far as like how it works in the workflow, like how to
Sure.
incorporate that into your
Yeah.
day. Cause I mean, we all know like the
Yep.
hygiene appointment already
Totally.
has a million things.
Totally.
But what is the process like? If I'm doing it to my patient, what am I doing to them?
Yeah, for sure. So before you're going to instrument is when you would want to administer a desiccant. And so
Okay.
typically desiccants, you can administer it with a syringe, like directly onto the calculus or the area that you're working, or it may be a deep pocket that you're having trouble instrumenting that you really want to target. You have definitely flexibility, or you can load up a tray, like a traditional, like an old school, like, fluoride foam tray. You can load up a tray and seat it, and the patient will bite down on it for 30 seconds to a minute, and it'll start activating. So I always say administering it right before you're about to start instrumenting, because again, 30 seconds to a minute is really that activation time for the product to typically work. But we obviously don't want to add any more to our already packed hygiene day. I totally get that. But if we think about it, if a desiccant is softening calculus, it's going to make it easier for us to instrument the time at which we're going to be spending with the patient, and our ergonomics and fatigue as well, quote unquote, should be in theory improved. So,
Yeah, it's like a net positive. Like it is
correct.
an extra thing, but also it's like
Right.
probably shaving off a lot of time
Right. And
scaling.
I mean, again, like I just talked so much about like biofilm and understanding what is in the biofilm. And I really do believe like that is the direction we're going with dentistry. And we can't just scale calculus and expect, yeah, we can get improvement, but really like long-term maintenance and really trying to alter patients' biofilms and getting them healthy is really the critical component.
Well, I like that we're focusing on biofilm because we all have those patients that come in clean as a whistle, don't
Hmm.
have a lot of tartar,
Right.
calculus, but their gums are still bleeding or they're
Right.
getting caries all the time. So,
Yep.
yeah.
And I also think it desiccate not only not to get I don't want to get off topic here, but not only benefits the hygienist, but it also can benefit restoratively as well, because we know that if there's that pellicle formation, that can inhibit how restorative materials are adhering as well. So desiccant can also benefit the restorative side as well. I just wanted to mention that too.
Oh, so, okay. So, a doc, if they're about to prep a tooth, it
Yep,
would maybe be wise for them to do that.
absolutely. Yeah.
So, like, if I have a clean tooth, like number 25, totally clean,
Yeah.
and I put the desiccant on there,
Mhm.
like, does it look different? Like, how do I know that it's ready?
For sure. Well, I think it depends on the product you're using. Like I know, like
Okay.
my favorite product is Turbo CR from EDS. Their desiccant, it flows and essentially it's a green color. I know there's another one, Perio DT is another one. It's like a more of like a raspberry darkish red color that you administer and it sits there. You don't necessarily will know it's ready, but typically the activation time for those products are 30 seconds to a minute. So if it sits on the tooth for 30 seconds to a minute, you know that the product is going to start working. At least for, again, my favorite one, Turbo CR from EDS. When there's two barrels of that product and they combine, and so when I know those two combine, the acid and the surfactant, I know it's going to start activating right away, and that acid is getting to work targeting that biofilm on the tooth surface.
I'm just thinking if a dentist, let's say they're prepping 28 and
Yep.
they apply the desiccant, but it's
Yeah.
not necessarily like a super plaquey or super
Hmm.
built up tooth. What are they actually doing after that? Are they scaling the tooth or are they just like rinsing it off?
Rinsing it off. Yep.
Oh,
Just rinsing it
dang.
off.
Okay.
Yeah. Yep. Because it's the acid. You don't really need the mechanical instrumentation. Obviously, if the tooth is clean, we've already done our hygiene treatment or if it's polished or whatever the case may be. But they don't need to go and scale the product off of there. It's really that acid is targeting the tooth surface. Because when that acid pulls the moisture from the biofilm has nothing to stick to anymore. So it just falls off of the tooth, essentially.
Hmm.
So then it leaves that nice clean tooth surface for that restorative material to adhere.
Okay. And is this something that can like be billed to insurance?
So from what I've gathered, I have not found an insurance code that can be billed.
Okay.
And so I think that would be up to the office as far as like if they would want to like incorporate that into like a fee if they were using it regularly, as far as like if they would build that into like the fee that they're charging a patient. Each company that produces a desiccant charges a different amount as far as like how, of what one bottle of the syringe costs. So I think that would be office dependent, but it really there's really not an insurance code. Yes, it is an adjunctive therapy, but I don't see it in the sense of like a restin or something like that.
Do you see that maybe in the future changing? Like,
I
because
do because
on my perspective, this is new to me. Like,
mhm,
I've never used this before. It's
mhm,
just within the last couple years that I've started
yep,
hearing about it.
for
So I
sure.
just wonder what's your vision in the future? Like, do you see this eventually being like coded and more used?
I think it is because I feel like this is like a very like low invasive but like very effective. And so like I think when we've talked about adjunctive therapies, I think that that's a huge deal in dentistry and dental hygiene, because I think again that gold standard of scaling root planing isn't enough. And so yeah, I guess if you're fine with just scaling calculus and then another 2 years doing SRP, another 2 years doing SRP, then that's your own prerogative. But I don't think that's why we're in it as hygienists. We're prioritizing prevention and we want to see patients get healthy. And so what else can we do to get them healthy? And I think, again, using a desiccant 30 seconds to a minute is something that's really easy to use and it's very effective because, yeah, we can certainly irrigate with various products, but they're not targeting the biofilms. Like if we talk about like mouth rinse or something like that, sure, it might inhibit like plaque formation, but it's not causing that cell lysis, that cell death within the biofilm and removing it from the tooth surface. Or even arrestin, yeah, local delivery antibiotic within the pocket. Certainly that's very helpful in a localized site. But if we're talking about the entire mouth, we're not putting arrestin every single, all over the place. And so I have found that using a desiccant is something that's very simple, but it can flow nicely into hard to reach areas too.
So I'm picturing it in one of those like little
Yep.
syringes. Okay, and so you can apply that both supra and sub. Like, is there any limitations on the use of it?
Yeah, so good question. So again, depends on the product. I'll speak on behalf of. I've seen various out there.
Mm.
Again, I know like Perio DT is one. Theirs is a simple, like a small syringe. My favorite one, Turbo CR from EDS. It is a bigger syringe and it's administered with a gun, like a restorative gun. But with that one, you can either have like you attach a tip on it and you can either load it in a tray or you can have a more fine tip attachment if you want to like deliver it directly into a pocket or in a specific area. So you could do it either way. I can't remember your initial question now. Sorry, I just got sidetracked there.
It's okay. Do you listen to the Huberman Lab podcast?
No.
Okay, it's a great podcast.
Okay.
I'm a huge fan, but I feel like I'm turning into him because he asks literally like 5 questions in a row, and I always feel so bad for the guests because 'cause they're like, "What?" You know? And I really gotta watch it. I don't know what
No,
I
that's
asked either,
okay.
but,
No, that's
um,
okay. That's okay. Oh, you
so
asked
when
about
we're
the
talking,
syringe, but anyway.
yeah. So why do you like that? What company is your favorite?
EDS.
EDS.
EDS
Why
makes,
are they
they
your favorite?
initially make, most of us hygienists probably know they initially, or they have made a lot of restorative materials, but they also make glove and care, the like hand cream.
Yeah. Oh,
But
I've heard
they've,
of that. Okay.
yes, but they've branched into the hygiene market and are now making a desiccant. And why do I like their product so much? I like their product because it's, of course, I don't want this to be too salesy. And at least I will actually brief this before I start talking about their product. I only love dental products that are backed by research, and there has
Okay.
to be a lot of research behind it for me. There has to be systematic reviews and meta analysis, and there has to be hard data, and it has to be statistically significant for me to be like, yes, this is a product that we want to use. Because and two, I teach public health. I talk about my students being advocates for their patients in the consumer space because there's so much out there as far as, the dental hygiene product market. It's so convoluted. And so I
Yeah.
want my students to be like critical evaluators of research and being able to be like, yes, I can recommend this product to my patient because it's backed by research. So anyway, that's my own little soapbox tangent, but I just
No, I
love
think that's
research and
great.
I think it's really important. So anyway, going back to EDS and Turbo CR, why I like their product, because there is research behind it for one thing. It's very easy to use. It's comfortable on the patient's teeth and gums. And so when I say that, yes, there is an acid in it. I think when we first hear acid, we're like, well, is it going to cause more sensitivity? Is it going to cause tissue sloughing? Like, are the patients not going to like it? And I like their product because after that 1 minute, the activation time of the product, it's essentially stops working. So it's really that 1 minute time is very critical. That's why we want to leave it on in the patient's mouth for a minute, but it's not going to cause any additional sensitivity after that. So the patients I found that we've used it on have been very receptive. It also has peppermint oil in it, which I think is very nice for patients. It doesn't taste bad.
I
And
was gonna ask about the taste.
yeah, it doesn't, at
Yeah.
least I like Turbo CR because yes, they have peppermint oil in there. So it's therapeutic for patients in that sense. So I like that there's two different tip options as far as you can load it into a tray or you can put it in a localized site. I found that it flows really nicely. And so that ingredient in Turbo CR, what we call a surfactant, is really, when we think of surfactants, we think of like soap in water. It gets very bubbly and foamy. And that's really what starts to dissolve the calculus. And I have found with that, it flows really nicely into interproximal spaces. I'm going to be presenting it under one roof about this product. And I have some images on my slides that I'm thinking of right now that show how nicely it goes interproximally. Or there was one area that I was working on, a 7 millimeter pocket on 18 distal, that I found that it flowed really nicely there. It's hard with research to really get a quantifiable number as far as like how far this product can reach subgingival. It's really hard to measure that, but I have found that I can deliver that product with the fine tip pretty well in some of those deeper pockets.
I'm just thinking of, our elderly patients
Yep.
like that come in and
Yeah.
they cannot care for their teeth or kids
Hmm.
or whatever.
Yep.
So, I guess like for a time management standpoint, if someone comes in and they're like, I'm doing half mouth SRP,
Yeah.
would it make more sense to load a tray and put that in or to apply it with the syringe? Like,
I
what's
think it's,
faster?
yeah, with the tray. And again, I work with students quite a bit. So I have exposed
Okay.
my students to this product. And we see a lot of patients in our clinic that have, limited access to care, don't have insurance, or we've seen patients that have gone extended periods of time without seeing a dental provider. So we do see quite a bit of involved periodontal cases. And yeah, I've definitely had my students or myself even administer half a tray. That's very easy to do. I find from a time standpoint, that's, the most efficient is just to load half the tray. Typically, like when I do it or with my students, we'll get the patient numb and then they'll go ahead and administer the desiccant. They'll rinse it off and then they're ready to go and start scaling. So I found that, yeah, administering a half the tray is really helpful. But if it is just
Okay.
one localized site that we're, struggling with, you could do that too.
So when the desiccant is like working for that 1 minute, are we like, is it okay for the patient to swallow? Are we giving suction the whole time?
Yeah, good question. So it's not harmful to swallow.
Okay.
You can give suction. Really, the only contraindications for this product, and I have at least, again, I'll speak on behalf of my product that I really like. There are others too, but the only contraindications, at least for Turbo CR, is a sodium saccharin allergy, which is I have found it's very uncommon. I know like perio DT, I think theirs is if you have like a sulfur allergy. So those are really the only contraindications. For pregnant women and children under 18, there's very limited research so far on this product, on, desiccants in general, because they are fairly new. So I think there's still more research that needs to come out using those. So anyway, but for the most part, you can really use it on anyone.
So do you, just because of that limited research, do you maybe just say not like use it
I
for
haven't
pregnant people
typically
or
used
others?
it on, no, I have not used it on anyone that's pregnant or anyone under the age of 18. No, it's really our, adults and I'd say periodontally involved patients, but honestly, patients that are adult prophy that have a lot of calculus too.
Yeah. So how has the reception from patients been? Like, do
Yeah.
they like it?
Yeah. I feel like patients, they haven't, I mean, I would say yes, patients like it. I haven't received any negative response. Some patients have said they felt it being kind of like tingly. Not necessarily, it doesn't taste bad. Patients have said it just tastes kind of minty. But I received the tingly response comment a couple times. I think probably just because of the acid. But I haven't heard patients say like any more sensitivity, or I know like from a clinician standpoint, because I mean, I've used it, but I've also like gotten lots of feedback from my students who have used it as well. And they've even like I've had students that have seen patients like that they've used it on, like when they saw a patient previously that they didn't use the desiccant, but then they used it at the follow up and they noticed like significant differences as far as like calculus tenacity. So I feel like both, I feel like patients and clinicians have been pretty receptive.
Yeah, this is great, especially just for those patients, because I've had them come in every 3 months and they're just like loaded
Hmm.
with calculus
Yep.
every single time. And
Yeah.
it's always those patients that hate
Yes.
being scaled. And it's
Yes, they
just like,
do. And you're just like
okay, like how's,
cranking on that calculus and like, yeah,
yeah.
your hand is like breaking. You're like, I need a little help here.
Yeah. So is this something that replaces other things that we might be using? Like you had mentioned, just SRP is still the gold standard, but
Yeah.
people are using, laser and
Yeah.
irrigation
Yeah.
and Arrestin and stuff like that. Is this a replacement for that?
That's a great question. And I don't necessarily want to say a replacement. I think every
Okay.
like adjunct has their, their need, right? Like we lasers like have there's reasons why we use lasers. There's reasons why we use, irrigation, I guess. But I think, yes, scaling replane would be the gold standard, but I do feel in my opinion that I feel like desiccation is I think it's I don't want to say conservative, but I feel like it's a better adjunct to be using because it is more general. Like if when we're talking about like antibiotics, it's really hard to know, like, I guess if you're doing saliva testing, to which bacteria we're targeting. But then we get into the discussion of antibiotic overuse, and that's just more of a concern as well. And I feel like that can be a little bit more aggressive with patients. When we're talking about
Yeah.
irrigation, yes, irrigation is helpful, but again, not really targeting the biofilms as much. And so I feel like I had something I was going to say and I just lost my train of thought, but that's okay. It'll come
It's
back to
okay.
me.
Happens to me all the time.
I'm like, dang it, I was going to say something, then I forgot what I was going to say. But I do feel, I don't want to say replace, but I feel like using a desiccant is kind of the way forward. The research is there. Oh, that's what it was. Research.
Yeah.
There was a systematic review and a meta-analysis that was conducted in 2024. And for those of you who are not familiar with systematic reviews, meta-analysis, it's the highest level of research that you could find and you could read. It appraises all of the evidence out there. And it looked at how desiccants were impacting biofilms, and there was statistically significant evidence looking at, I'm going to like pull it up really quick because I want to
Yeah,
make sure I
sure.
read it correctly and I have it written down. This study was published in the Journal of Clinical Medicine, and it looked at topical agents in biofilm disaggregation. And so it was determined that at a 3 to 6 month follow up, there was statistically significant results demonstrating pocket depth reduction between baseline and follow-up using a desiccant. And there was a significant reduction in both aerobic and anaerobic bacterial species. And then the other study that was also evaluated too, and I think this was just a randomized clinical trial, but this one looked at red complex bacteria, which we know are very, very harmful. And it showed a decrease in red complex bacteria after 15, 30, 60, and 180 days. And these remained for up to a year. And that was also statistically significant. So there is a lot of research behind this product. So I don't necessarily like to use the word replacement as far as replacing other adjuncts, but I think this is a more conservative and very beneficial adjunct to use with scaling and root planing.
Yeah, I mean, that research sounds like I got excited when you were reading that. I was like,
Yeah.
holy cow, this isn't
Yeah.
just like making scaling easier. It's like
No.
literally improving the periodontal health of the patient.
For sure. And I think really understanding, we talk so much about bacteria in the mouth, and saliva testing I think is very beneficial to understand what is specifically going on, because we do want to individualize every single patient and we do want to prioritize prevention, and we can't just scale calculus and expect things to get better. Yes, of course we have to remove calculus, but there's a lot more going on. And so really understanding the specific microbes and targeting those microbes and individualizing care for the patient, I think is really, really beneficial.
So what's your vision for the future for this? Like what would your dream be? Like every single patient at every office getting desiccation therapy, whether they're perio or not?
Yeah, I mean, I think it's really obviously prioritizing patients that are healthy and not healthy. So, of course,
Mhm.
if your patients are healthy, they're coming in routinely, all your clinical parameters are looking great, like very light calculus, biofilm's healthy. Like, I don't really see the need to use it. But for
Mhm.
the patients that you've been seeing historically and they're historically doing well, and then you start to see a change, why not introduce this and see if we can get some of that inflammation? Because clearly there's some dysbiosis going on. There's some bacteria ramping back up. So maybe introduce the desiccant, have them back even in 4 months and see how things are doing, or even 4 to 6 weeks and see if you notice any changes, and kind of get them on a tighter schedule for those patients. Then for your perio patients, maybe like you said, that patient that you've been seeing, historically for routine maintenance, or they get scaling root planing done every 2 to 3 years. And it's just like, we cannot get ahead of it. Let's introduce the
Mhm.
desiccant and see what kind of response we can get. So I think my vision is, yes, I would love to see this in every hygienist toolkit. I don't like using the word toolkit, but everyone tool chest. I don't know. I think this is just something that could be very much a mainstay. I know for me as an educator, I love exposing my students to it because, again, this is the direction we're going. And I think it's so exciting for dentistry, because what was once very challenging for us as hygienists, getting patients stable and getting patients healthy, feeling that we were kind of spinning our wheels, I feel like we have a way through now with GBT, and we're really understanding what's going on within the biofilms. And I know we've been harping on that a lot, but I feel like that really is such a heavy topic of discussion. And so I love exposing my students to this. I would love to see this become more mainstay for them. And I don't feel like, I guess I just had this thought in my head. I don't want anyone to think that using a desiccant is like a crutch when it comes to scaling
Mhm.
calculus. I don't want it to be viewed in that instance, because you still have to remove the calculus. You still have to have excellent instrumentation skills in order to remove the calculus. At least for Turbo CR, the research they've conducted has shown that it's reduced the hardness of calculus by 48%. So it's not like the calculus is just buttery melting off. You still have to remove it.
Yeah.
But it's reducing the amount of time at which you're spending getting those really tenacious pieces of calculus off there. So I envision, I would, again, in my unicorn world, I would love to have all my students exposed to this regularly. I would love all clinicians to be able to use it, because it's something that's so simple and it takes less than a minute to administer it. So why wouldn't we, if the research is there and it's very beneficial?
Are there I mean, obviously, I see the implications for hygienists using this. You already mentioned restorative dentists, but
Yeah.
I'm also thinking of periodontists or orthodontists,
Mhm.
trying to with those brackets. Like I
Yep.
worked at a general practice and they also had an orthodontist in house. And so
Cool.
I'd see all the ortho kids and it was a mess. So
Oh,
have you had specialists use this as well?
I haven't, but that would be something that I would be really interested to talk with them and get their take on it. I have
Yeah.
not. communicated with specialists too much about it. But now that you mentioned that, I feel like my wheels are spinning. I was like, oh, I should talk with a periodontist here in town or orthodontist here in town, because like just like you had mentioned, like when I'm in practice and I've seen those ortho kids that come in and they have like severe inflammation and they're at risk of
Yeah.
their ortho getting taken off because they're just so inflamed. And there are, obviously, yes, oral hygiene is so critical, brushing, flossing, irrigating, using your water pick. But there are also the patients that are like mouth breathing. And there's so many other like compounding factors as to why we're seeing gingival inflammation. But also, too, you could have that patient that has, again, their biofilms are working against them. And so if we can target that and help them out, that would be, very beneficial. Again, yeah, in the perio offices, like how many patients have we referred to the periodontist? And yes, of course, there are those patients that, need significant surgery and flaps and different things that are, beyond our control, of course, bony defects, so many things. But hey, maybe if we started introducing a desiccant, early on and really targeting the biofilms and helping promote a positive bacterial environment earlier on, then maybe we could prevent some of these bigger issues later down the road.
Oh, for sure. And I'm just thinking of periodontists, like, yes, their job is different because they
For
can
sure.
flap it and visually
Yes,
see,
of
but they
course.
still
Of
have to
course.
scale a lot of calculus. And so I
Yep.
just imagine this would maybe make it easier for them.
Yeah, and maybe when they do flap it, like they could like introduce this into some of those areas and really
Yeah.
help, promote an adequate environment. And, I even think about like I just had this thought in my head, like even when implants are placed, right? Like if there is bacteria, like harmful bacteria that is like hanging out like where the implant is placed, like are we setting the patient up for success, down the road? Are we going to see that implant failing down the road? So it's like if something like this, something so simple with the acid in this and the surfactant in this, that's really targeting those harmful bacteria and really promoting a healthier environment before we place an implant or before we place a restoration, then like why not?
Yeah, it's interesting that you mentioned implants because I interviewed someone on salivary testing and
Oh,
he was
great.
like, he said it nicer than this, but he was
Yes.
like, if people placing implants aren't
Yes.
testing for
Yes.
these
100%.
bacteria, what are you doing?
Exactly. Yes.
Yeah.
Exactly. And I that's the other thing too. I also will say with desiccants is that you can safely use these products on all restorative materials, which I think is also very, very helpful. So it's safe on
Okay.
implants, it's safe on
So it doesn't itch
restorations.
it
So
or
no.
anything.
Yeah, no.
Okay.
Yep, safe on titanium. Yep. Yeah, it's completely fine. So, but yeah, I'm so glad you brought that up about the, saliva testing and understand like what's going on down in there because it's very important.
Well, it just all of this stuff really excites me, but it also
Yes.
I feel myself being frustrated too because dentistry seems to be so slow when it comes to like
Oh,
adopting these newer things that are
yes.
clearly better than what we've been doing for the last 50 years.
Yep. Yeah. And I totally feel that. I've always said, I should say always, but I have felt that dentistry or dental hygiene is like slightly behind because I'm going to try not to get on a soapbox about
No,
this
I love
because,
soapboxes. Do it.
okay, because in my professional opinion, I feel that dental hygiene is somewhat behind because we need more original research to move our profession forward. But until we, one, are self governing, which I know is a hot topic, and two, until we have, even like a doctoral degree within our profession where we're producing our own original research within dental hygiene. Right now, all of the research that is conducted is, I mean, it is dental research, but it's not being conducted like within dental hygiene. Like we don't have a doctoral degree in dental hygiene. And typically doctoral degrees like in academia is where more research is coming from. So the like most of the research within the US comes from private institutions like universities. And so anyway, that's my own because I love academia and I love research. And I really do feel that we need more research in dental hygiene. That's how we move things forward. But until that point, until, we are self-governing and we have more, educational opportunities, I think that is somewhat of a barrier, in my opinion.
No, I'm sure you're right. And yeah, things are just crazy right now. And it seems like
Yes.
we've been needing to do these things,
Mm-hmm.
right? Become self governing, fully autonomous, whatever.
Yep.
You're the
Yep.
doctorate degree you
Yeah.
mentioned. We've needed that stuff for a long time. And I think I'm hopeful that drama
Yeah,
And
for
the
sure.
stress that we've got right now will be a
Mhm.
catalyst for us to make those changes,
Yeah, for
hopefully.
sure. So, but yeah, I mean, I'm excited about this, going back to our desiccation topic, I'm excited about this product and I really do hope that hygienists can get their hands on it. And I think that's the other thing with hygiene too is I love hygienists because they're always finding ways to better our patients. And so I think once hygienists do try out this product and get their hands on it, then I know it will transform your practice.
Is there a way for them to just try, like, are there samples? Is there a way for them to just try it?
Yep. So unfortunately, there aren't, at least from Turbo CR, the product I love,
Mhm.
they don't have any samples. I'm not sure about the other companies. I know this is going to come out after Under One Roof, but
Mhm.
at Under One Roof, we are going to be giving out lots of free product to try. So I'm
Okay.
hoping that hygienists can come and try that product. Otherwise, you could certainly reach out to the companies and see about getting products specifically from them if they're really interested in trying it. So, but yeah, samples are kind of a challenge.
Yeah, yeah, I just know people love samples, so
And that's, I mean, I feel like, yeah, once you try it, then I know, at least for me, like once I try something and I believe in it, then I'm going to be more motivated to recommend it, of course, and want to use it. So
Oh, for sure. Were you introduced to desiccants, like, when you were practicing clinically, or is this something that you just stumbled on and fell in love with it?
it's honestly something I stumbled upon and kind of fell in love with
Okay.
it because I mean, I've been exposed to like lasers and saliva testing and antibiotics and different antimicrobial rinses. But I was starting to hear more about like GBT and I was like hearing things about desiccants and calculus softeners. And I was like, what is this? And so I just started doing my own research and yeah, kind of one thing led to another. And I just was like, wow, this is like really transformational. Like, I think this is huge for hygienists. Like, I think this is a huge breakthrough. I honestly feel that way.
I know you're speaking at Under One Roof. Do you
Yeah.
speak, like, regularly on this?
I haven't spoken too much on this. I am giving the new product presentation, so because
Mhm.
this is a newer product, but I haven't spoken too much on it. But I would like to speak more on it because, again, I do believe in it, and I feel like it is really going to help hygienists. I mean, I've been on the receiving end of very tenacious calculus and patients that I've worked super hard on scaling and replaning that is still a refractory case that isn't getting better, and I'm just beating my head, and I'm just like, what else? And I've honestly felt like that ever since I graduated dental hygiene school. That I've always felt I'm like, what else can I do for these patients? What else can I do? Like, someone, please tell me. And I even, even as an educator, when my students are like, Miss Walters, I've done everything correctly and this patient still isn't responding. Like, what else can I
Yeah.
do? And I'm just like, and so
It's a
I'm
hopeless feeling.
it is a very hopeless feeling. And
Yeah.
I'm like really encouraged that, I've just started using this product in the last year. And I'm really hoping that as I continue to incorporate it into my practice with my students, that we will see improved clinical outcomes. I think that's really the goal.
Well, we talked about its effect on biofilm and, like, these bad bacteria. Is this also good for patients? Maybe they don't have perio or they don't build
Yeah.
up calculus easily, but they get caries like crazy. Is this good for them too?
That's a great question that I haven't really come across too much in my research, but I'm hypothesizing that it is.
I would think so.
Yeah, I'm hypothesizing that it is because again, when we're talking about sticky biofilms, like very, very
Mhm.
sticky biofilms, and if we're really trying to target those and understanding what's within patients' biofilms and what is making one patient at higher risk for caries than another, I think that this could be very beneficial for them as well. And I just think about like even like the space kind of going off on a side as far as caries risk, but even like iodine, povidone
Oh,
iodine,
yeah. Uh-huh.
like POV1, and how that is altering the microbial environment and inhibiting caries in patients. So I don't see why desiccation therapy could do the same thing.
Oh, yeah, for sure.
That's a great.
So, what I actually want to ask, I don't know if you'll know the answer to this, but are there other healthcare specialties that use desiccants besides
Um,
dentistry?
so I'm going to go back to, I also have a note on this as well. So desiccation therapy isn't new. Like I had mentioned, the practice of drying or dehydrating things for preservation, it's really ancient, like drying foods, because again, desiccation essentially is just, it's dehydrating. It's removing water, moisture, humidifying from the environment, from the biofilm. And so I did some research and it like dating back to like 370 BC. I had mentioned this earlier, but they were kind of drying like seeds to keep them alive. And so again, it's been around for a long time, even in the medical and science context. Within like medicine right now, I don't know the answer to that. I just
Yeah.
know that the practice of dehydrating things and removing moisture from things has been around for a long time.
Okay. Yeah, it's
So,
just really interesting and it seems so simple.
mhm.
Just
Yeah.
taking the moisture out, that's it.
It is because,
But
yeah,
it
if you
makes
think
sense.
about it, yeah, we remove moisture. The biofilm is dry; it can't attach to the tooth surface anymore, so then it just gets flushed out during treatment. So,
Yeah.
essentially, yeah, it's they're taking that moisture out, absorbing that moisture and humidity from the environment. So,
Yeah, that's cool. I really wanna try it. I feel like so I've been practicing for over 17 years, and honestly, I do feel like a dinosaur now. Like, I've never done desiccation therapy, I've never done GBT. I'm sure there's other stuff that I haven't done, and I don't
yeah,
practice as much anymore because of my
yeah,
business, so I
yeah.
just feel like I'm falling behind.
Well, and I mean, I honestly feel like that too because I'm not in clinical. I mean, most of my career was clinical practice, and then since in the last year, transitioning into academia, last year and a half to 2 years, I'm not, seeing patients like every hour on the hour all the time, and so I'm
Yeah.
like just trying to stay like current as well, like you said, and it's like it's interesting because, like you mentioned, like how dentistry it sometimes it takes so long to incorporate things, but it also is crazy how quickly I feel like I get behind on things at the same time.
Yeah.
So it's kind of interesting. But yes, yeah, if you I haven't been exposed. I mean, I know about it as far as GBT. I haven't like done it myself. So that's something new that I haven't been specifically able to try yet, but I feel like I can get behind it. Like I feel like I understand it, just like desiccation.
Yeah, I had, Kevin,
Yes.
yeah, on talking about
Great. Great.
GBT and
Yeah.
everything
Yeah.
that he said, I was just like, "Yeah, I mean, yes, it totally makes sense."
It
I
makes
haven't done it
sense.
myself, but I can
Right.
I can get behind it too, you know?
Yes, definitely. Yeah. It's
Yeah.
awesome. It's really exciting.
So are there any, like, I don't know, myths or misunderstandings that people have about desiccants that you wanna clear up?
Well, I think the one question that I always get when I tell people about this is they're always like, well, does it actually work? Like, is this legit? Like, does it
Yeah.
really soften calculus? And I'm like, I feel like that's one myth. It's like, how can this actually work? And it does, because again, if you think about it, I'll kind of go over the ingredients again, because I feel like this is how you show that. But I already talked about the research, but I think the ingredients really speak for themselves. We have the acid component and the surfactant component. The acid, again, targeting the biofilms, removing the moisture, inhibiting that pellicle smear layer. And then you also have the surfactant. And the surfactant, the molecule itself attaches to the tooth surface of the calculus, and it kind of starts to dissolve it, like eating away at it a little bit like soap and water. And it starts to clump up, all those proteins in the sense, and makes it easier, and it kind of lifts it from the tooth surface and makes it easier for you to remove that calculus. And then whatever remaining surfactant material after you remove the calculus that's hanging around from the desiccant inhibits that pellicle formation on the tooth surface. So it does work. The material, the ingredients that are included in the product speak for themselves. Easy to administer. Again, I'm not a salesperson by any means. I've never worked in sales. I'm not going to be like, use this product, like just try it, and then if you try it you'll like it. So I think that's really the biggest thing for me as a hygienist is I'm only going to talk about products that I like, and I know that it helps my practice. So yes, I would
Yeah.
love for other hygienists to try it too, but just try it and see for yourself. It does actually work. I think that's one of the biggest myths is people are like, well, does it actually work? And I feel like it does.
Well, and what you said earlier too is like it's not like a magic bullet that you just put it
No.
on and then you're not going to have to
Right.
scale. Like you're still going to have
You
to
still have
scale.
to
I
instrument.
could see people being like, "Oh, I don't even have to scale if I use this,"
No,
but
it's
that's not
not
true.
like it's like melting it off. Like, no,
Yeah.
it's just removing the moisture so it's lifting off of the tooth surface to make it easier for you to remove that calculus. So the art of hand instrumentation is never lost. Like it's still very important. So we still have to remove those tenacious calculus, but it's just I think a little bit more in detail.
Man, I would like because I can remember so many patients that would come in and I would love the patient, but I would dread
Oh,
working on them because it was like
yes.
even if it was every 2 months, they would come in with this tenacious calculus. So literally anything that could make my job easier, I'm down.
Yeah, 100%. I mean, I've had those patients too where I'm just like, there's not enough time in this hour for me to remove
Yeah.
all this calculus. Like, and we're just going round and round and you're doing all the things correctly. But I also think about it too. I'm like, they're brushing and flossing and water picking, all these things. But I'm like, but were we targeting the biofilms at that point? Like, are
Yeah.
there still harmful biofilms that are just, is there like coating the tooth surface despite all my instrumentation efforts? Like that the biofilm is still there and it's very sticky. So that could be,
Yeah.
inhibiting and contributing to more calculus accumulation.
Is this something that not just is used in the office? Can patients use this at home? Like, can they put it in a tray and just almost for like maintenance to keep the calculus from building up?
That's a really great question that I don't know the answer to, and I would have to find that
Okay.
out. I don't know like how effective it would be, and maybe we need more research on that, but I'm wondering like how effective, like how often it can be applied because I don't know the answer to that, but I would
Oh,
have to find that out. Same thing with like fluoride applications or like bleaching, like how often like is it, effective and safe. And so for patients to just be like constantly using it, I'm not really sure how effective or safe that would be. And I would have to find that out. That's
yeah.
a really good question that I don't know the answer to.
Yeah, and that's true. It's like I always am hesitant to send patients home with things that
100. Exactly. Yeah.
because some of them can just really, cause some damage. Like, if
Yes.
they ask for my scalers, I'm like, "Absolutely not."
No.
No.
Yes. I've had patients that are like, I do some like woodworking. Can I have like your old scalers? I'm like, I don't know about that. Or can I
Yeah,
buy one on Amazon? I'm like, I don't know about that.
I know. It's just like, "Nope, I'm not gonna recommend any of that. Thank you."
Exactly.
Yeah.
Exactly.
So if people wanna learn more, about you, connect with you, or learn more about desiccants, what's the best place for that?
So, if you want to learn more, or if you want to hear more from me or contact me, you can find me on my website, AnnieWaltersRDH.com. I'm also on Instagram, AnnieWaltersRDH. I'm on LinkedIn. So, you can reach me in all those spaces or AnnieWaltersRDH@gmail.com. You can email me. Yes, I will be under one roof. I know this is coming out afterwards, but I'd love to connect with anyone about desiccation therapy. I think this is a really breakthrough therapy for patients, and I'm really excited for you as hygienists to get your hands on it. If you want to find out more about desiccation therapy, I can connect you with research, or if you want to try out my favorite product, Turbo CR, that I've talked about quite a bit on this podcast, edsdental.com/turbo CR. They have a wealth of information on their website too, great videos, my testimonials, any, research and thoughts that I have, I'd be happy to share.
Awesome. Well, I will put links to all of that down in the
Great.
show notes just to make it easier for people.
Excellent.
And good luck. Not that you need it with your presentation at
Thank
Under One
you.
Roof. That's huge. Yeah.
Thanks so much, Stephanie. I really appreciate it. I've thoroughly enjoyed this conversation.
Awesome. Me too. Well, thank you again, Annie, for your time. And thank you, everyone, for listening. We will see you next time. Thank you for tuning into this episode of Straight Up with Steph and being interested in living better. What many listeners do is subscribe to the podcast because that allows them to automatically get the latest episodes of the show. Remember, you are the best person to take care of you, and by learning what we talk about on this show, you're taking one more step to being a healthier and happier you. I'll talk to you soon.